Hey everybody, it's Brian with the Health Story Project, and today's video is about at-home low-intensity frequency training for weight loss. Um, so to introduce the topic, many people believe intense exercise is critical for large weight loss and or weight maintenance, but this is clinically and theoretically false. Higher intensity training, cardiovascular exercise have many effects that are counterproductive to weight loss, and low intensity frequency training for weight loss has ample theoretical and biochemical support in terms of how it can help you and promote weight loss. So to discuss my personal results, I've lost 50 pounds, and 40 of that was within the last 4 months. On the left, I was at about 230 pounds, and on the right, I'm at 178, and that is my progress as of today. No gym, no intense exercise, no cardio, and it was all just frequency training and diet. For a bit more history about my personal weight loss results, like many people, I gained a lot of weight during COVID. I personally was drinking and eating out more than ever, and I reached about 230 pounds. I maintained that for a little while, but after cleaning up my diet a little bit more, I ended up getting to 216 pounds and maintained that up through about May 1st. On May 1st, I started taking the weight loss more seriously and began frequency training. I was still drinking occasionally, but I cleaned up my diet quite a bit, and I got to 184 pounds last month. I lost another 8 pounds since to get to my current weight of 178 pounds to date, and I plan on losing the remaining 15 pounds, hopefully within a month. I've been overall very pleased with frequency training. This is the most that I've used it kind of consecutively for this amount of weight loss. I am seeing a little bit more definition coming out in my arms, and apologies for the poor progress pics here, but definitely still got to work on my belly a bit, but overall, a lot of improvement. So here's what my diet and exercise look like since May 1st. The diet was combinations of fasting VSCD, which is very severe caloric deprivation, and refeeding. It has a nutrient focus over a caloric focus, so there's no food logs or calorie counting. That said, VSCD does have target caloric intake. It's just not required to be exact. So if you're familiar with the caloric estimations for what you're eating, it's good to go and you don't need to do it. Exercise, no gym, no intense workouts, no cardio, all at home, low intensity frequency training. I got a rowing machine, so I'm doing rowing at home for my sustained exercise. I usually target it at least an hour a day. Um, if I wanted to mix it up or throw something on top of that, a lot of times I would do weighted vest walks as well. Also had ankle weights. Um, and for resistance training, push ups, squats, and dumbbells. And I would focus more on push exercises since rowing is pull. The first thing that I need to bring up is the disambiguation between frequency training and frequency of training, because frequency of training is not what this is about, and it is the most common reference to frequency in mainstream discussion. So, frequency of training is something like working out daily or how many times per week that you work out. Frequency training is an exercise method and a paradigm. It is a less common approach, but some bodybuilders swear by it. It's similar to two-a-days and strength and athletic training. One of the other examples that's used to highlight how it can be so beneficial or its results is, mechanics have large forearms, soccer players have large calves. They don't need to work those out specifically because they're frequently training them so much throughout their professions. An example how to use it at home: if you're used to going to the gym for an hour or even working at home for an hour, break it up into 5-minute intervals every hour, 12 times in the day for the same total workout of 1 hour. That way you get more frequency of workouts in the day. When designing a frequency training routine, you have to balance the frequency of workouts with the intensity of the workouts. For strength and athletic training, you do sometimes see two, maybe even three a days, and those workouts will have some intensity to it. But for promoting weight loss, you really want to have a larger frequency of workouts compared to the intensity. And low intensity workouts also has several benefits for weight loss. It reduces risk of injury. It's non-impact and non-ballistic. It's better for novices, those who are severely obese, and those with any type of physical injury or ailment. And sometimes when we get injured, it's very easy to fall off whatever our diet and normal exercise routine is. Low intensity also allows sustained exercise for over 30 minutes, and that's important. That's one of the keys to rowing and the weighted vest walks, because it's been shown that when you have a elevated heart rate for over 30 minutes, there are several benefits that promote weight loss. Even though frequency training is used far less often than traditional approaches, it does have several benefits, particularly regarding the average person who's exercising. It reduces catabolism and has anti-inflammatory effects. And reducing inflammation improves many chronic health issues, not just obesity, type 2 diabetes, cardiovascular disease, cancer, sleep apnea, and many more. Regarding obesity, it is much larger than calories and is also impacted by malnutrition and weight history on top of inflammation as well. Frequency training is easily able to be worked into daily schedules. It helps improve mood and energy throughout the day, and it has additional health benefits for desk workers. Frequency training can also be done at the gym if preferred, or on occasion to mix things up. More consistency can lead to less likelihood of missing days or falling off altogether. Some examples of frequency training you can do in the gym: rowing, incline and walking, stairs or steps, Jacob's ladder. Volume training, that's going to be 100 plus reps with low resistance. Another great benefit to frequency training is that it can be easily incorporated into daily life. If you're out grocery shopping and you're missing one of your intervals, park further away, do a lunge or two on the way, make some light physical work and exercise. When you get your groceries, do some curls with them on your way out. Lift them above your head. If you're doing cleaning in your house, you lift up the vacuum cleaner into the air. Wrap the cord when you've got it up in the air to get a nice long hold. Yeah, and if you have kids, run in circles or play sports more with your kids. I'd much rather be spending time uh, multitasking and doing my training in my daily life than having to spend that time in the gym where I can't be doing things I need to get done in the day or spending time with my family. Traditional approaches like cardiovascular exercise and or working out the gym have several disadvantages. They take more time, they tend to cost more. They're both big producers of pain and soreness from lactic acid buildup. They're also counterproductive compared to dietary focus. It can require as much as 1 to 3 hours to burn 600 calories. Meanwhile, you just cut out a meal and you got that right there. Some specific disadvantage of focusing on cardiovascular exercise is that it produces large amounts of cortisol, the inflammatory stress hormone. And obesity is being discovered to be less and less from causes of caloric intake and other, instead of other factors like malnutrition, inflammation, uh, immune system issues, and much more. The body adapts to energy expenditure very quickly and doesn't trigger EPIC. So you don't get the same caloric burn as you do with resistance training. High impact exercises can cause knee and hip injuries. I know swimming and other cardiovascular exercise may not all be high impact, but especially with running, um, it definitely causes a lot of knee and hip injuries, both immediately and over time with age. Resistance training has a lot of overall health benefits compared to cardio, including high intensity and heavy resistance training. But the issue when it's used for weight loss is that it can cause overtraining. If your body can't recover because of a nutrient or caloric deprivation or a lack of sleep or anything else that could be associated with a caloric deficit and weight loss, it can be the cause of overtraining and then be highly catabolic. Putting it all together, we've got diet first up. Pair low intensity frequency training with a VSC diet, or reduce caloric estimations for only light physical activity if you prefer a diet based on caloric calculations. Do focus on nutrients over calories. Eat more fruit, vegetables, healthy proteins, etc. Eat less sugar, fast food, processed foods, etc. There are a lot of reasons why weight loss may not occur if you're not eating a very nutritious diet. You can also check out the Engineer's Diet. It's available on Amazon with extensive details on diet, including VSCD diets and fasting approaches. Talk about different food options and quality issues. So check it out if you're interested in really diving into the details on my recommendations for diet. And here's what daily workouts should consist of: at least one sustained elevated heart rate workout for at least 30 minutes, rowing, weighted vest walking, stairs, etc. If you do multiple of them in a day, it's just fine. The more the better. The one condition I'll talk about a little bit more in detail later is that don't overdo it. If you start to feel pain or fatigue, then tone that down. At least one set of an upper and lower body exercise with heavy resistance. And focusing on heavy resistance can be highly catabolic, but doing it limitedly can be very anti-catabolic. So make sure to do push-ups, squats, weights, or something at least once a day for upper and lower body, and restrict to less than 25% of total exercise. This is just ballpark. It's not that important. The main key point here is don't overdo it. Don't get fatigued. 1 to 5 minute sets every 2 hours between sustained exercise. If you're not rowing or doing your weighted vest walking or anything else, every couple hours, do a set of some sort of exercise. Get down, do a few push-ups, have some dumbbells, do multiple arm exercises, whatever you want to do. But limit it to one per hour and focus on the muscle groups that you're not working out in your sustained exercises. I am advocating for more people to work out at home, but there's not a lot of difference in effectiveness between the home or the gym. Either can be slightly advantageous. Push-ups versus presses. Push-ups are using more stabilization muscles, and typically speaking, you're going to get better results, particularly for weight loss, the more muscle mass that you can incorporate. Incline walking versus high stepping. High stepping could get the job done, but incline walking is one of the best lower body workouts for frequency training. Sustainability, though, is above and beyond any small differences in effectiveness. Use whatever you are most comfortable with, use whatever suits your schedule the best, use whatever you enjoy more. The point is, I do want to advocate for working out at home to get over the stigma that it is any less effective. So do whatever is going to be best for you. Another stigma to get over with frequency training is pain is gain. Pain is not always gain. Pain is often a sign of overtraining, muscular imbalance, and injury. Low intensity frequency training should not be painful. It should not be to the point that you're fatigued or you are risking injury. Do use it to work through lactic acid buildup. For those who haven't done a lot of exercise, it can sometimes be hard to know the difference between being fatigued and excessive muscle soreness versus just lactic acid buildup and needing to work that out. Frequency training is actually a recommended practice to reduce lactic acid buildup, so just tone it down if you need to. Start light in the day and during sustained exercise. That can reduce soreness and has benefits from progression. And if you do need to reduce how much you're doing, reduce the exercise weight or volume, not the frequency. So if you're used to doing sets of 5, right, every 2 hours, keep doing them every 2 hours, just do a set of 1 or 2. Do something, but keep that frequency of workouts. To wrap things up, weight loss can be successfully achieved without intense exercise. Make sure to pair your diet according to the nutritional needs of your exercise, and low intensity frequency training can provide many weight loss advantages compared to traditional approaches and working out at the gym. Thanks.